Well, welcome to the 7 o'clock talk with Dr. Miller and Nurse Jessica from Integrated Health of Indiana. We're waiting to see the dog. She evidently does not know that we are broadcasting. Must be outside with Gracie.
Yeah, she must have been outside.
So, tonight we're going to talk about PCO and PCOS, unless Jessica goes to sleep. She's been working outside all day. She spread another, 15 bags of mulch and cleaned the barn and did the hay and. So, anyway, so we're going to discuss the difference between PCO, polycystic ovaries, and polycystic ovary syndrome. And so, just to start off, well, let's dissect the diagnosis. Because in medicine, we like to name it and blame it. And so, basically, when you hear doctor terms, they're generally Latin or Greek, just saying what it is. Um, and so, or what the observation is. So PCO means poly, and poly is many, and then cystic or cysts, and then ovaries. And so PCO kind of precludes PCOS, and you have an ovary that has had. We're going to get into a little bit of terminology here with the hormones, but follicle stimulating hormone has caused a lot of these to actually start to mature. And the trick here is you at mid-cycle need to change and have luteinizing hormone come online, and then one follicle will mature, the others will be discarded or they will be reabsorbed, and then there's a chance for ovulate or a chance for fertilization. So, and then what makes the S different in PCOS, the syndrome?
What do you mean, like characteristics?
Yeah.
Oh, like hair growth, weight gain. I'm
You're blinking.
Hyperinsulin, insulin resistance.
And that's actually been determined to be the root cause. So you hear a lot of people talk about the root cause of things, and hyperinsulinemia, insulin resistance, has been shown to inhibit the transformation in women of testosterone to estrogen. And so if somebody has, so let's go through some of the more common symptoms. PCO, polycystic ovaries, most people will have a lack of, or most women will have a lack of ovulation. They'll be infertile. They have a hard time conceiving, and that's because that luteinizing hormone doesn't kick in. And then you have irregular or missed periods sometimes, and then many follicles or cysts in the ovaries. And so, women, when they have this, what do they complain of?
Well, how they usually figure out they have it is because those cysts grow and grow and grow, and they never are released normally. So they get large, they get super painful, and if they are allowed to rupture on their own, a lot of times they'll have internal bleeding. But a lot of times they have such severe pain that they think they're having, well, depending on what side it's on, they might think they're having appendicitis. And so they present to the emergency department. They'll do, a scan, find that, they have cysts on their ovary, and some of them get quite large. And they go in and actually drain those, because if they rupture, it actually destroys the ovary bit by bit. And that actually is a life-threatening emergency if it's bleeding.
You should only have about, they say, 10 to 12 of those follicles starting to mature, and then one. That's what should happen. In somebody with PCO, then they can have 20, 50, 60 of these things. So you can see where that starts to be a problem. And so, symptoms of PCOS, one of the main things that happens in PCOS is there begins to be metabolic markers. And those metabolic markers are obesity. They'll start to get high cholesterol, glucose will go up, insulin is up. Actually, insulin goes up before glucose. Acne, and women will start to get, they will become testosterone dominant. And so they start to get facial hair, and they'll get hair on their stomachs. And so the excessive hair growth. And how does that present? Once again, most of the times in our patients, they're infertile and they have a lot of acne and they can't get rid of the acne. And so it's one of these things that once you know what's happening with some testing and some guidance, it's really easy to start to reverse this. And it's really easy to become pregnant, because what's one of the first things they do in the fertility clinics for people so that they can try to become pregnant? They give them berberine. They give them metformin.
I was going to say they wouldn't give them berberine. I've heard of metformin.
Yeah. So they'll give them metformin. We have different, because for those of you that are new, she's a nurse, classically medically trained. I'm a chiropractor, that I'm also a functional medicine doctor. And so for me, what I get to play with to help people with resensitization is we try to get to those root causes, which typically can be stress, it can be diet, it can be lack of exercise, and then we can start to help with getting the body resensitized to insulin. And you don't have to use drugs. You can do this naturally. You can do this without the intervention of pharmaceuticals. Sound good?
Yep.
And so, yep, Provera is another common one.
That would be a fertility specialist that would give that, or sometimes your OBGYN. A lot of times your OBGYN will give you the metformin and see if that works, and then you start moving up the ladder.
But here's the thing. You should really, and thank you, Dorothea, we appreciate that. Haven't been back to CrossFit in a while. Just the mornings don't work for us. We have too many things to do. But going back to the PCOS, the big thing here that I have a problem with, and they say that the practice of medicine is 17 years behind the research. The newest research is starting to show that the baby is affected, or the embryo is affected in utero by the environment. So if the mother has PCOS or PCO, then what happens is typically those insulin levels are high. And you can go look for kids born to women with high insulin levels, their chances of obesity, diabetes, and all of those metabolic diseases and disorders is more than doubled. So if you don't give this the good old college try of trying to get this taken care of naturally and get your lifestyle in check, then there's a problem. And that can affect, they're now seeing generational issues. They can see from the people that were in the concentration camps, the thrifty gene turned on for 2 to 3 generations. And so you can do that to your baby if you have these hormonal issues. So let's go back to, I kind of explained LH and FSH, but did you realize, or did you know, you want to tell them how common PCOS is?
Well, I still think it's way more common than that. They say 1 in 10 women. I would say that's probably really low in our area. In our area. So I'm assuming their information is nationwide, but when I look at our community specifically in our area, I would say 25 or 30%, and maybe even more than that.
Because if you look at the rates of obesity in the Midwest where we're at, anybody who's obese will have problems with their hormones. And that's kind of what we deal with. That's what we deal with the most, because we can get the lifestyle ironed out pretty quickly. but it's getting those hormonal issues and getting people to the point that they're producing their hormones and they're sensitive to their hormones and the receptors are using their hormones. That's the trick. But so far we're batting 1,000 for pregnancies. I say 1,000 instead of 100% because we've had several patients who didn't think they could get pregnant when they go through and we start to fix stress and these things, they get pregnant. Mm-hmm. I always laugh when they come in and they say, "Oh, Dr. Miller, you got me pregnant." And I'm like, it wasn't me. But that's kind of a running joke. Anyway, those things are very, very common. And people do not have to go to such extreme lengths. We have people that we know that are mortgaging their houses that haven't tried the natural approaches, which there's generally very little expense to. And especially very little expense if you compare it to in vitro fertilization. And not that that isn't needed sometimes, but why wouldn't you, if you're going to have a party and you're going to invite people over, don't you usually clean your house up first? So if you want to become pregnant, or if you have PCOS and you have facial hair and you have acne and this, that, and the other, wouldn't you rather clean the house up before you start to look into any of these other things?
Well, and I chuckle at like the acne because you get that acne all in your face after a certain age is not normal.
Yeah.
But everybody always wants to clean their face to get rid of it, and they scrub and they put stuff on their face, which really isn't helpful. Most of the time it's irritating even more because it's within.
Yep.
You got to change what's inside, not put stuff on the outside. Some of your taco salad?
So with that being said, PCOS is absolutely reversible. It's a lifestyle disease, just like diabetes, just like even any of the hormones can be related to lifestyle issues. There are things that you can do that cause these problems and you can reverse them. Let's put it that way. And my brain was going to just how many chronic diseases are because of lifestyle. And this is just another one of them that's because of lifestyle. And if you want to get rid of this without going through IVF and without increasing the risk of diabetes and such things, clean your house up first and then start to.
Go ahead. I was going to add something.
Start to try again.
Well, because we talked about the high insulin levels when you become pregnant and how that affects the baby. Just think about doing IVF and infertility and all that stuff, and all like these people come with 5-gallon buckets full of vials and needles and all the things that they've injected to try to become pregnant, and those are all synthetic chemicals, and they are all going to affect that child.
Yep. So takeaways. So real quickly, things that you can do if you have polycystic ovaries. Definitely get your blood sugar checked. Definitely get your insulin checked. And then there are things you can start to do, because if those things show positive, and just remember medically, if you have a problem with insulin, they let your insulin go to 26. In the functional medicine realm, optimal is between 3 and 4 fasting, and definitely less than 6. And people have problems with diabetes and metabolic issues at levels of 10 and less. So 6 is definitely you're got to stay lower than. Once you start to get up into those other things, that's when the chronic diseases really start to kick in. So you can absolutely take care of these. You can help your hormones. You can help your metabolic health. You can help your skin, hair, nails, teeth, all of that, just by taking care of these things. And so I don't know what else to add. I mean, hey, it's super simple steps. Get rid of soda. I don't care if it has artificial sweeteners or sugar, because artificial sweeteners change the microbiome. If you're using sugar or high fructose corn syrup, well, you just blow insulin right out of the water right there. So stick to water, coffee, tea. Those are the best things to drink. Not that you can't have a soda once in a while. I had a drink at the concert this weekend, but it was only one. And so, it's not that you can't ever have anything again. It's that you have to pay attention and you have to be moderate in what you do. And the definition of moderate is 1 to 2 a week, not 1 to 2 a day. Get on a whole foods, eat simply diet. Get 8 hours of sleep.
Yeah, the number one thing to help yourself in my information that I'm going through is you must get on a regular sleep pattern first.
Yep.
Then you got to eat good fats. Don't be afraid of fat. Just make sure it's good fat, because then you'll have the building blocks to make your hormones.
And then exercise.
But don't go crazy with the exercise, because you'll actually create the problem you're trying to fix if you go overboard.
Yep. You stress yourself. And then last but not least, then you can start to get into community and friends and stuff like that. And if you're doing all those things and you're still having issues, well, then absolutely you need to see somebody like us. Some tests need to be done. And with those tests being done, then you can start to resensitize the cells to insulin and start to reverse these things naturally. Thank you, and you have a wonderful evening. Ooh, it just quit. It's cancel. End.